Hello, good evening everyone. Good evening guys. It's Jovita once again on live video. Today's topic, guys, I'll be talking about second semester's uh courses you need to know in your first year nursing school, and one of them is fundamental of nursing. So now guys, if you are watching me for the first time, please like, share, comment, and don't fail to subscribe. So now today's video, like guys, we have about on these uh, courses we are talking about, you have about six basic topic you need to deal with in as long as this second semester uh, first year course, second semester first year courses are concerned. So guys, in first course you need to talk about is fundamental of nursing, and in fundamental of nursing, guys, there are a lot of topics that comprises or that you need to deal with as long as fundamental is concerned. And one of them is history taking, guys. In history taking, guys, you need to have a proper history taking of a patient, previous of his health, illness, and present, so that will enable you to know how to administer care to this particular patient. Then the next topic you will look into is pain assessment, guys. In pain assessment, you need to talk about know whether the pains are objective, whether they are subjective, and you also talk about heat and cold application, so how you can be able to manage this particular uh, patient. Then in another topic you need to understand is wound care, guys. In wound care, you talk about dressing, changing, irrigation, and uh, you talk about phases of wound care: first phase, second, third, and fourth, and their healing processes. So this is all you need to know. Then the next one, guys, you need to talk about is aseptic technique. In this aseptic technique, guys, you need to know all about sterilization. I mean surgical sterilization, both surgical gowns, or anything that has to do with sterilization. That is all you need to know. Then you now talk about hygiene, guys. In this topic, in hygiene, you talk about body care, you talk about oral care, you talk about massage, and all of it. So in this case, you need to know how to bathe the patient, the kind of, depending the kind of illness the patient is going through. If they cannot be able to take shower by themselves, this is all you need to know. Brushing their teeth, and the kind of hygiene you need to give to them or practice, even when you want to administer that care and after administering that particular care. Then the next one you need to talk about is vital sign. Then vital sign, you need to talk about temperature, you need to talk about high blood pressure, you talk about oxygenation, you talk about respiratory, and you talk about pulse rate. These are vital signs that you need to document, or you need to put into consideration. You need to take them in order to know how the body system of that particular patient functions. Then the next one is body mechanism, guys. In body mechanism, you need to talk about the abduction and induction, the fusions of the body system, what the body exercises. You talk about isometric and isometric, and you talk about isokinetic and all of it. So these are body mechanism. You need to talk about it, and you need to know about it, and how the body move and how they are being positioned. Then the next one you talk about is drug administration. the forms of drug. How are they being administered? Are they administered through, spray, through cream, through liquid, oral, solid, that kind of, forms of drug administration? This is all you need to know. And you also consider the calculation method, because when giving over of it, it is also dangerous for the patient. So you need to be very, very careful. This is all you need to understand. Then the next one is nutritional assessment, guys. In nutrition assessment, all you need to talk about is the intro nutrition. How does the patient feed? Does she feed by herself, that is orally? Does she feed through nasogastric procedure? Does she feed through lavage? This is, or gavage. These are process by which these patients feed. So you need to take a very cognizant, or you need to take a very good note of how the nutrition goes, so that you'll be able to document properly. Then the next one is also perinatal nutrition, guys. In perinatal nutrition, what you need to know there is form of administering medication through injection. So we have three basic forms by which nutrition, medication can be administered. One is intradermal, the second one is subcutaneous administration, and the last one is intramuscular. This is the three main ways by which you can administer drugs. Then the next one you ought to talk about is what? Characterization, guys. You need to talk about characterization in fundamental. You talk about how you know the passage of physics or some waste products, drainages, and all the rest of it. Then you also talk about enema, that is a patient going through constipation, how to assist the patient, to void or pass out, if she's going through if she's going through, hard times in going to the toilet. So we say it's enema. Then when you talk about, we also have another topic you need to talk about is edema as well. So in this area, that is, you talk about, patients, observation of patients. Edema is just the swollen bodies, whether they are diabetic, that kind of stuff. So this is all you need to know in this particular fundamental of nursing. And you also talk about blood transfusion as well, or intravenous IV injection, that is in certain drip to patient, and calculating the drops, calculating it in drops per minute. So this is all you need to know. Then the next one is about comfort, sleep, and rest management of a patient. So these are basic things you need to know as long as fundamental nursing is concerned. Guys, the next topic again you need to deal with is health assessment. In health assessment, it has to do with anatomy of the body system. In health assessment, you need to assess this patient from head to toe to know where they are having lapses or where their illnesses lies, in order to know how to administer a holistic care to them. Then the next one is, guys, is professional nursing. In professional nursing, previously I talked about nursing history, which has to do with Orem, Dorothy, Orem, Johnson, talk about Nightingale, and all the rest of them. These are philosophers of this particular profession. Then in professional nursing tells you that is the area of specialization, because there are people who specializes on this profession by practice, training, and all the rest of it. But under this is just how you specialized on it professionally. maybe obtaining your degree and all the rest of it. This is all you need to know. Then the next one is communication skills, guys. In nursing, you have to learn the basic needs for communication, irrespective of the religion, culture, or background of that particular patient. So communication is very, very necessary. The next topic you need to talk about in this area is microbiology, which I I know you know that it normally deals with bacteria, parasites, fungi, ground staining, and all the rest of it. This is all you need to deal with as long as second year, first semester courses are concerned. Guys, bye.